Hi, welcome back. I'm Jenny Noonan, and welcome to the live broadcast portion of our show. I'm joined in the studio today by Susan Stone, EPA Senior Policy Analyst.
Hi, Jenny.
Hi. And Kimber Scavo, Group Leader for the State and Local Programs Group.
Hi, Jenny.
It's great to see you both here. Thank you for joining us. Well, before we get to the questions today, I'd like to announce two of the winners we have from the trivia question. Let me go over what that trivia question was. What was the air quality index called before it became the AQI? And the answer is the Pollutant Standards Index. And I'd like to congratulate two of our winners, Robert Day from DC Government and Patricia Belts. Thank you for calling those answers in. And now let's get started.
Okay.
Susan, why did EPA tighten the 1997 ozone standards?
EPA's decision to tighten the ozone standard is based on a large and robust body of scientific evidence, more than 1,700 new studies. And what these studies told us is that the effects of ozone on human health are more damaging than we thought in 1997, and that these harmful effects can occur at lower levels. Now, ozone can aggravate asthma and other serious lung diseases, leading to respiratory morbidity effects. And not only that, the population of people that we consider to be sensitive to ozone is potentially very large, including people with asthma and chronic lung diseases, children, older adults, and people who are active outdoors, including outdoor workers.
Wow. And did some of the studies focus on those sensitive groups?
Yes, they did. Yes, they did.
Great. Thank you. And Kimber, we've had a lot of questions about how EPA is going to be working with the states and local governments related to this new standard when many are still working on the 1997 standards. What specifically is EPA doing to help local governments meet the 2008 standard?
Thank you, Jenny. EPA has issued a number of rules that will help reduce ozone. For example, we have issued Tier 2 tailpipe standards for new cars and light-duty trucks. We have heavy-duty diesel standards, and the soon-to-be issued, I think it actually was issued this past March, on locomotives and marine diesel rules. We've also issued the Clean Air Interstate Rule and the NOx SIP call, and most recently some rules on consumer and commercial products. There's also some additional work that we're doing on stationary sources, and anything that the states are working on toward their 1997 SIPs, controls that they've put on, combustion sources, coding categories, all of those will be able to take credit for any SIP that we get for the 2008 standard.
Great, thank you. That's very helpful. We have a question that has been phoned in already, which is, I know that there were early action compacts, and those are a program that we started with the 97 standard. It's always only been ozone. It was about a half a dozen communities that signed up for that. And someone has called in and asked, will EPA be considering a similar early action type program for the 2008 ozone standards?
Yes, thanks. That's a very good question. We are currently right now doing an evaluation of the past Early Action Compact program. We hope for that evaluation to be complete in the next couple of weeks. At that point, we'll be taking the results of that. We've been working with our regional offices and the states that were involved last time and briefing our management on the results of that evaluation and then making a decision. So we hope that within the next month or so we'll have a decision on that.
Okay, great. And Susan, what did the CASAC, can you tell us who CASAC is and what they had said about the 2008 standards?
Well, the CASAC is the Clean Air Scientific Advisory Committee. It's a federally chartered committee to advise EPA on policy, on the science and policy decisions. They're a peer review panel that peer reviews our science assessment, and then they also peer review the policy assessment. And so the Clean Air Scientific Advisory Committee approved of our review of the science, and then they recommended a standard within the range of 0.060 to 0.070 parts per million.
Great. Okay, well, Kimber, I think there's been a question here. Could you please discuss how EPA will work with state and local communities to address difficulties in meeting non-attainment requirements despite the influence of transport?
Thanks, Jenny. Also a good question. We will be probably doing some similar workshops that we did when we released our PM implementation rule. We had workshops with the states. We're contemplating doing something similar to talk about different control strategies. We also plan on releasing a control measure, control strategy type of guidance document that may help some of those areas, the state and local areas, develop additional control strategies for what they already have for the 1997 standards. For new areas, those are the ones that haven't really done a SIP before. We'll try to target those areas with our new control strategy guidance so that they get the best information that we have. So we've thought about possibly doing another satellite downlink for states to talk specifically about what those states should be putting in their SIPs. States, after designation, states will have another 3 years to do those SIPs, so we feel we have time to work with them to get them up to speed on what they need to be doing.
And has EPA done anything to help out with transport with their past programs?
Yes, I mean we've done the NOx SIP call, we've done the Clean Air Interstate Rule. Both of those programs will help reduce transport. We'll just have to see if we be able to take another step to deal with transport for the new standard. That's something that we'll have to consider internally.
Okay, great, thank you. Susan, I know that you just described the KSAC recommendation as being .060 to .070, and the administrator selected .075.
Right.
And could you describe a little bit about his thinking in setting that as the primary standard?
Sure, Jenny. Well, the most certain evidence that we have about the ozone's effects come from clinical studies. These are studies where they put people in chambers, expose them to ozone, and make measurements of lots of different physiological functions. And most of the studies were conducted at exposure levels of .080 and above. Only one author reported studies at lower levels. And basically the administrator felt that this evidence was too limited to provide a focus for a standard at that level. The level of this standard was also based on epidemiological studies, many epidemiological studies. But there are significant uncertainties about the effects of ozone and whether they're related to those specific effects at very low levels. And so considering all of the available information, the administrator judged that a standard set at .075 parts per million was requisite to protect public health with an adequate margin of safety, including the health of sensitive groups. And a standard set at .075 parts per million provides considerable additional public health protection over the 1997 standard.
Okay. And for the first time, if I'm not mistaken, with this standard, the 2008 standard, EPA is saying that ozone causes premature death.
Right.
How is this? What new information did you have since '97?
Right. Well, at the time in 1997, there was a little information that linked ozone to mortality, but it wasn't really considered to be a specific effect. But since that time, we have new large multi-city epidemiological studies and meta-analyses. These are studies that combine information from other studies, and they show a robust association between ozone and premature mortality. This robust association holds up even when other factors are considered that might be associated with mortality, including high temperatures or particulate matter. The other piece of evidence that we have is from toxicology studies, and what they provide is evidence of potential mechanisms by which ozone can cause these effects. And so this provides biological plausibility for the findings of the EPI studies.
And you described epidemiological, you used that a couple of times. Could you just describe for the audience what an epidemiological study is?
Well, an epidemiological study looks at typically population level health information, compares it to air quality information, and sees if there's a relationship.
So it's usually a large number of people?
Yes, yes.
Okay. And while we're taking a step back to talk about the big picture, can you just describe for us, Susan, for a minute, what a National Ambient Air Quality Standard is?
Well, EPA is charged under the Clean Air Act to set national ambient air quality standards for ubiquitous pollutants. And so we set national ambient air quality standards for the 6 criteria pollutants, including ozone, particulate matter, carbon monoxide, nitrogen dioxide, sulfur dioxide, and lead. And so that's what we do.
And we do that every 5 years?
That's the schedule that we're supposed to be on, yes.
Okay, great. Okay, we have a question that just came in. Were people with heart conditions considered as a sensitive population in this review?
There is some initial evidence, new evidence, that ozone can affect cardiac-related outcomes. But in assessing the evidence, we decided, and the CASAC agreed, that it's premature to say that people with heart disease are a sensitive subpopulation. But there are links between ozone and cardiac-related effects, and also it is considered that people with heart and lung disease are the ones most likely to die from ozone exposure.
Kimber, how will, one of the questions we've gotten in is, how will EPA designate areas? What information will they be using for this 2008 standard?
Okay, first let me just say that we're probably going to be finalizing designations no later than March 2010. That means that we'll either be using 06 to 08 data, depending on the ozone season. There's different ozone seasons depending on the state, or 07 to 09 data. So it'll either be one of those data sets for final designations. For state recommendations, which are due March 12, 2009, the data that will be used will either be 04 to 06, or it's possible that that could extend 05 to 07, depending on whether the data is QA'd in time, and again, based on the ozone season of the state, whether they can get their data QA'd in time to meet that deadline.
Okay, great. And remember, we're looking for your calls and emails and faxes, so if you could, call the phone number 1-888-228-6736. You can fax your questions in at 919-715-3569. And we're also taking your emails, and that email address on your screen is open@ncmail.net. Okay, to return back to the panel, Kimber, when does EPA intend to publish an implementation rule for the 2008 standards? I know there's been some delay in the 97.
Right. We are currently working on responding to the court vacature, as I mentioned in my presentation earlier in this broadcast. We're looking at this fall to respond to that court for the 1997 standards. We're also doing an implementation rule on transitioning from the 97 to 2008 standards. We're also looking at proposing that separate rulemaking this fall. It may go into the winter, depending on how many issues that we get in for transitioning. We're starting our briefings now. We're working with the regional offices now on deciding which issues we need to include in that proposal. We're looking for states to submit their questions to us on things that we want to make sure we address in that proposal now. So that's where we are currently. And again, we hope to get that proposal out this fall.
Okay, great. And you mentioned you were looking for questions from the states. Is there some sort of process that you're?
Yes, we've actually inquired with NACA that if state and local agencies have questions, they can submit them a number of ways. They can submit it to Chris James at NACA, who's collecting comments that were questions that way. You can submit them to John Silvasi, and in one of my slides I had his email address that came up. You could submit questions to John. He works in the state and local programs group. We'll collect questions here today as well. So 3 ways to get your questions in, or your regional office. That would be another way to get your questions of things you think we should be addressing in any transition proposal this fall.
That's great. So it's really an opportunity for state and locals to inform and make sure that the proposal that we put out either this fall or winter addresses the concerns that they have.
Absolutely.
Okay.
Thank you.
Okay. Well, Kimber, also, can you tell me a big question that comes up often is, how many new non-attainment areas are there going to be because of the 2008 standards? Am I going to be non-attainment? What advice can you give to people?
Well, as I mentioned, it's too soon to tell how many actual non-attainment areas are going to be, because we're not going to do designations till 2010, March 2010. Lydia showed some maps that showed that I think there were 345 counties with monitors that would not meet the new primary standard. And doing projections out to 2020, that number increasingly goes down. And since those maps were used with 04 to 06 data, it's possible, there may be fewer counties if we're doing designations with later data because of rules that come in that have helped some states come into attainment prior to the time we do designations. But looking at those maps, there's quite a few counties that have monitored violations right now, but we won't know how many non-attainment areas there'll be until we do final designations in 2010.
Okay, and one of the nuances, as I recall from those maps, is that the maps are only counties with monitors, so they're not the whole MSA, they're just counties with monitors, which is important for people who are trying to sort through
That's correct.
Look into the crystal ball, as it were.
Right.
Okay. Well, great. Well, Susan, could you tell us, I know you've been working on the Air Quality Index for a long time. Can you tell us what is that and how it's different as a result of the final rule?
Well, the Air Quality Index is a public communication tool that tells people about daily air quality and any health effects that may be related to that. State and local agencies use it to tell the public about the level of the standard. What we have done is we have revised the Air Quality Index to be consistent with the new standard, and we've revised the breakpoints around it proportionally to the adjustment to the daily standard. And so this will allow states and local agencies in a timely manner to communicate to the public about the changes in the standard.
Great. And how do you hope that the public is using the AQI? Like, I'm a runner, I want to get up in the morning. What is it your hope for what people use it for?
Well, I hope that people will tailor to the AQI to their own conditions. Basically, the Air Quality Index it isn't a perfect tool. You know, we can't predict. I can't predict, for example, how you would experience air pollution. And so each person has to kind of customize the Air Quality Index for themselves. And so I hope what you would do is check the Air Quality Index before you go out for a run, and then notice if you're having symptoms. And if you're not having symptoms, great. But just kind of keep an eye on it, and what you'll learn is that what your sensitivities are, if you're sensitive to different pollutants or different levels of different pollutants. And that's important for people with asthma as well. Let their symptoms be their guide. And when air pollution levels are high, people with asthma should have an asthma action plan, and they should follow it at that point.
And for a healthy, someone who considers themselves healthy, who's an active working outside on a Saturday morning, and there's a red alert day, what are some of the symptoms that they might be experiencing that they can now maybe identify with pollution?
Right. Well, with ozone specifically, coughing, sore or scratchy throat, chest tightness, shortness of breath, pain when taking a deep breath. These are all symptoms that you need to reduce your exertion level. And so if you're working in the yard and you start to experience symptoms, cut back on your exertion level a little bit. It doesn't necessarily mean that you need to go indoors, but it does mean that you need to reduce your exertion levels.
Okay. And while we're on the subject of the AQI, we have gotten a question in that you were probably expecting, which is, what can you tell us about the PM AQI? First, can you tell us how that index came about, and then the status of it now? How, why we decided to include PM as a part of the AQI? Because was it always part of AQI?
Well, PM10 has been part of the AQI as long as we've had a PM10 standard. In 1999, when the PSI became the AQI, we included PM 2.5. But currently, the 100 level of the PM 2.5 subindex is set at 40 micrograms per cubic meter. The daily standard is now 35 micrograms per cubic meter, 24-hour average. We've developed a proposal to revise the PM 2.5 subindex, and it is currently undergoing interagency review.
Great, thank you. And this is for Kimber. What is the let me think here. What is the best way to explain the additional number of AQI? Okay. It's for you. Susan, what is the best way to explain the additional number of AQI days that will result from the new standard? I think the questioner is, there going to be a lot of yellow. Are people going to start to become desensitized to it?
Well, I mean, I think what we recently had the National Air Quality Conference, where we spent a lot of time engaging with state and local agencies on how to deal with these types of communication issues. And I think most states are very well prepared to let the public know it's not that air quality is getting worse, it's that we know more about the health effects. And so we're advising you at lower levels. I mean, we've done this before. We did it when we developed the Air Quality Index initially. And when we added PM, initially when we had the air quality index, PM wasn't part of it. It wasn't until we got a monitoring network that allowed us to do it. So that resulted in more code orange and code red days. And so we've had to do this periodically, and I think the states are well equipped to handle this type of communication issue.
Okay, great. And let's put up again that address and phone number and email address for people to be able to call, fax, or email in their, or phone in their questions. If you want to call us, that number is 1-888-228-6736. The fax number is 919-715-3569. Or we're taking your emails at open@ncmail.net.